Welcome to CBT training. This module introduces participants to the basic principles and concepts of CBT. Let's begin with Unit 1, Introduction to Cognitive Behavioral Therapy. Cognitive behavior therapy is a type of psychotherapy that focuses on the role of thoughts, emotions, and behaviors in mental health. It is based on the idea that our thoughts and beliefs can influence our feelings and actions, and that by changing our thoughts and behaviors, we can improve our emotional well-being. CBT is a short-term, goal-oriented therapy that helps individuals identify and challenge negative thought patterns and behaviors, and learn new, more adaptive ways of thinking and behaving. It has been shown to be effective in the treatment of a wide range of mental health disorders, including depression, anxiety, obsessive-compulsive disorder, and post-traumatic stress disorder. In CBT, individuals work with a therapist to identify specific problems and goals for treatment, and develop a treatment plan to address these issues. The therapist may use a variety of techniques, such as cognitive restructuring, exposure therapy, and behavioral experiments to help individuals identify and challenge negative thoughts and beliefs and learn new coping skills. Unit 2, the role of thoughts, emotions, and behaviors in mental health. In CBT, thoughts, emotions, and behaviors are viewed as interconnected and influencing one another. Negative thoughts and beliefs can lead to negative emotions and behaviors, while more adaptive thoughts and beliefs can lead to more positive emotions and behaviors. For example, if an individual has the thought "I am not good enough," they may feel anxious or depressed and may avoid situations that make them feel vulnerable. On the other hand, if an individual has the thought "I am capable and competent," they may feel more confident and motivated to take on challenges. By identifying and challenging negative thoughts and beliefs and learning new, more adaptive ways of thinking, individuals can improve their emotional well-being and change their behaviors. CBT helps individuals develop skills to recognize and manage their thoughts and emotions, and to identify and modify problematic behaviors. In summary, CBT is a useful tool for addressing a wide range of mental health issues by helping individuals identify and challenge negative thoughts and beliefs, and learn new coping skills to improve their emotional well-being and behavior. Unit 3, Assessing Problems and Goals for Treatment. Assessing problems and setting goals for treatment is an important first step in cognitive behavior therapy. This process helps to identify specific areas of concern and establish clear, achievable goals for treatment. There are several ways to assess problems and set goals in CBT. One common method is to use a functional analysis, which involves identifying the thoughts, emotions, and behaviors that contribute to a specific problem and the specific consequences of those thoughts, emotions, and behaviors. This can help to identify patterns of thought and behavior that maintain the problem and inform the development of goals for treatment. Another method is to use a hierarchy of goals, which involves ranking goals from most to least important or most to least difficult to achieve. This can help to prioritize treatment goals and ensure that progress is being made towards the most important or challenging goals. Unit 4, Developing a Treatment Plan. Once problems and goals for treatment have been identified, the next step is to develop a treatment plan to address these issues. A treatment plan should include specific strategies and techniques that will be used to address the identified problems and achieve the established goals. There are several components to consider when developing a treatment plan in CBT. These may include the frequency and duration of therapy sessions, the specific techniques and strategies that will be used, the specific problems and goals that will be addressed in each session, homework assignments to practice skills between sessions, the timeline for progress, and review of the treatment plan. Developing a treatment plan is a collaborative process between the individual and the therapist. It should be tailored to the specific needs and goals of the individual and may be modified as treatment progresses. In summary, assessing problems and setting goals for treatment and developing a treatment plan are important first steps in CBT. These steps help to identify specific areas of concern and establish clear, achievable goals for treatment and inform the development of a customized treatment plan to address these issues. Unit 5, Introduction to Identifying and Challenging Negative Thoughts. Identifying and challenging negative thoughts is an important aspect of cognitive behavior therapy. Negative thoughts and beliefs, also known as cognitive distortions, can contribute to negative emotions and behaviors and can maintain or exacerbate mental health problems. In CBT, individuals learn how to identify and challenge negative thoughts and beliefs using a variety of techniques, such as thought records and cognitive restructuring. These techniques can help individuals to recognize and modify negative thought patterns and develop more adaptive and realistic ways of thinking. Unit 6, Identifying Negative Thoughts. The first step in challenging negative thoughts is to become aware of them. This can be more difficult than it sounds, as negative thoughts can often be automatic and unconscious. However, by paying attention to your thoughts and emotions, you can begin to identify negative thoughts and beliefs that may be contributing to your problems. There are several strategies that can help you to identify negative thoughts. Keep a thought diary. Write down your thoughts and emotions as they occur, and try to identify any negative thought patterns or themes. Notice your emotions. Pay attention to your emotions and try to identify the thoughts that may be causing or maintaining them. Monitor your self-talk. Pay attention to the things you say to yourself and try to identify any negative or unhelpful thoughts. Unit 7, Types of Cognitive Distortion. Cognitive distortions are biased or irrational thoughts that can contribute to negative emotions and behaviors. Some common types of cognitive distortions include all or nothing thinking, seeing things in black and white without any shades of gray, overgeneralization, drawing broad conclusions based on a single event or piece of evidence, mental filter, focusing on the negative aspects of a situation and ignoring the positive, disqualifying the positive, discounting positive experiences or accomplishments, mind reading, assuming you know what others are thinking without any evidence, fortune telling, predicting the future negatively without considering alternative outcomes, emotional reasoning, believing that your emotions reflect reality, should statements, putting pressure on yourself or others with statements beginning with should, must, or have to, labeling, using negative labels to describe yourself or others, personalization, blaming yourself for things that are not entirely your responsibility. Unit 8, Using Thought Records to Challenge Negative Thoughts. A thought record is a tool that can help you to identify and challenge negative thoughts. It involves writing down a negative thought, examining the evidence for and against the thought, and developing a more balanced and realistic alternative thought. To use a thought record, follow these steps. 1. Identify a negative thought that you would like to challenge. 2. Write down the thought and rate the intensity of the emotion that it generates on a scale of 0 to 100. 3. List the evidence for and against the thought. 4. Identify any cognitive distortions present in the thought. 5. Develop a more balanced and realistic alternative thought. 6. Rate the intensity of the emotion generated by the alternative thought. Using thought records can help you to become more aware of negative thoughts and beliefs and to develop more realistic and adaptive ways of thinking. Unit 9, Using Cognitive Restructuring to Challenge Negative Thoughts. Cognitive restructuring is a technique that can help you to challenge negative thoughts and beliefs and develop more adaptive and realistic ways of thinking. It involves identifying and challenging cognitive distortions and replacing them with more balanced and realistic thoughts. Cognitive restructuring is a technique that is used to identify and change negative or distorted thoughts that can contribute to emotional distress. It can be a helpful tool for managing anxiety, depression, and other mental health concerns. Here are the steps for using cognitive restructuring. 1. Identify the negative thought. Pay attention to your thoughts and try to identify any negative or distorted thoughts that are contributing to your distress. 2. Challenge the negative thought. Examine the evidence for and against the negative thought. Is there another way to interpret the situation or evidence? 3. Replace the negative thought with a more balanced or positive thought. Try to come up with a more realistic or positive way of thinking about the situation. For practice using cognitive restructuring regularly in order to change your thought patterns and improve your emotional well-being. It may be helpful to work with a mental health professional, such as a therapist, to practice cognitive restructuring and learn other strategies for managing negative thoughts and emotions. There are a variety of strategies that can be helpful for managing emotions. 1. Identify the emotion. It can be helpful to take a moment to identify and label the emotion that you are feeling. This can help you to better understand your emotional experience and respond to it in a more mindful way. 2. Practice self-care. Taking care of your physical and emotional needs can help to regulate your emotions. This can include things like getting enough sleep, eating well, exercising, and engaging in activities that you enjoy. 3. Use mindfulness techniques. Mindfulness involves paying attention to your present moment experience in a non-judgmental way. Practicing mindfulness can help you to become more aware of your emotions and better able to manage them. 4. Use cognitive restructuring. As mentioned earlier, cognitive restructuring involves identifying and changing negative or distorted thoughts that can contribute to emotional distress. 5. Seek support. Sharing your feelings and experiences with others, such as a trusted friend or family member or a mental health professional, can be a helpful way to manage your emotions. 6. Engage in activities that promote emotional regulation. Engaging in activities that promote emotional regulation, such as deep breathing exercises, progressive muscle relaxation, or physical activity, can help you to manage your emotions in a healthy way. Unit 10, Introduction to Emotional Awareness. Emotional awareness is the ability to recognize and understand your own emotions and how they influence your behavior and thoughts. Developing emotional awareness can be a powerful tool for managing emotions and improving overall well-being. In this chapter, we will discuss the importance of emotional awareness and provide tips for improving your emotional awareness skills.